Good afternoon, ladies and gentlemen. As per my promise and looking into the demand from the viewers, today I am going to speak to you about blood pressure. All of you are aware that blood pressure, by and large, people suffer from hypertension or hypotension. Hypertension means high blood pressure, and hypotension means low blood pressure. Now, here in this context, let me, as a word of caution, I have been guiding you people and I have been telling you that acupressure is very effective, and but in case you feel that there is an iota of a life risk for a person, that the person is almost sinking, or the blood pressure has shot to 200 plus level, or diastolic is something like 110 plus, then we should use this therapy only as a first aid. But otherwise you will find that it's so effective that in case, suppose I assume a figure of 180 by 100 or 105, the moment you start giving pressure, the pressure points will be discussed and put in the description box also, separate charts for high and low blood pressure. But you will find that within a span of 15 to 20 minutes, the level has come down from 180 to 150, 60, and the diastolic level from 105 to, it may come down to 95 or even 90. But as I have been telling you that I never want you people to commit a mistake. So play safe, try to get the medical aid as early as possible and use this therapy as a first aid. Later on, when the pressure is stabilized, continue to do with this and you will find the results. And gradually, in consultation with your physician, you can cut down the intake of the medicine also, but strictly as per the advice of your physician. So now I get going on this, that we know that blood pressure is an ailment connected directly with your heart, because heart is the organ in our body which pumps the by expansion contraction, जिसको हम लोग दिल धड़कना कहते हैं, कि जब वो एक्सपेंड करता है और कॉन्ट्रैक्ट करता है तो ब्लड जो है वो वॉल्स को जाके टकराता है, जिसको आर्टरीज में, वेन्स में, तो उसको हम लोग कहते हैं, उसको नाम देते हैं कि भाई ये ब्लड प्रेशर ज़्यादा हो रहा है या कम हो रहा है. नाउ अगर मैं इन टर्म्स ऑफ एक्यूपंक्चर भी बात करूँ, क्योंकि हम साथ साथ दोनों को लेके चलते हैं, तो मैं आपको एक्सप्लेन करता हूँ कि ये लेफ्ट साइड में हार्ट होता है, तो आपको पता ही है. फर्स्ट पॉइंट हार्ट का यहाँ पर है, जिसको हम आमतौर से ओमिट करते हैं. देयर आर ओनली 9 प्रेशर पॉइंट्स इन द हार्ट मेरिडियन. देन ये जो एल्बो है, एल्बो बोन जो है, इससे 2 फिंगर विड्थ ऑफ द पेशेंट अपसाइड and 2 finger width of the patient below the elbow bone. Here is the point called HT2, and in between we leave the elbow and HT3. Thereafter, in the wrist, here are 4 pressure points. They are in the vicinity of 2 finger width or 2.5 finger width in the wrist on the outer edge, anterior side. So HT2, HT3, HT4, HT5, HT6, HT7. Now in the palm, if I close my fist where the little finger touches, there is the reflex point for the heart. So this becomes HT8, and point number HT9 is here at the end of the finger where the nail starts. Now this point has also been pressed. Now very important thing I want to share with you is there is only one difference between hypotension and hypertension treatment, and that is that rest of the pressure point discussed so far are connected with the heart meridian stimulation of the heart. So they remain same. The only difference is that for hypertension, we have to give pressure on the little finger away from the thumb. This is my thumb this side, so away from the thumb, I have to rub it 10 to 12 times with adequate pressure. And in case I am handling a patient of hypotension, in the middle finger, this place, I have to give pressure towards the thumb. So away from the thumb for hypertension, towards the thumb for the hypotension. These details you will find in separate charts also, which I have put in the description box. Now thereafter, again I want to emphasize that all the 4 little fingers, 2 in the hand and 2 in the feet, have to be given pressure. There are no pressure points relating to high blood pressure in the feet except this one. Now I hope these points are clear to you. And then there are other things also, like intake of salt should be less for hypertension, and for hypotension it can be a little bit more, and other precautions like coffee for low blood pressure. So thank you so much, and give me the feedback for the next disease you want to do. Thank you.